2 months after my shoulder revision surgery, and I'm still dealing with the nerve injury. Hey, everybody, how's it going? This is Sam. Hope you are doing well and staying pain free. So, I'm making this video to kind of like update on the 2 months shoulder revision surgery, and it's been nothing but frustration and headache and lots of pain. As I mentioned to on the other video, I 2 months ago, I had a shoulder revision surgery, and I had a major damage to my nerves and the whole brachial plexus. That's what they call it. That's what the medical term is for all these nerves in here. It's severely stretched. For the first 3, 4 weeks, I was not getting any functionality or sensation to my arm and fingers and hands. But thereafter I start having a little bit of sensations and a little bit of the functionalities coming back. And this is exactly 2 months, and I'm still dealing with a lot of the nerve damages and hoping some of them will still come back. And one of the nerves is still not firing yet. Disclaimer. Everything I talked about in the videos are purely my own experience. The surgery is done on my own. Treatments are done on my own. Therapies are also, my own therapy. Also, treatments and other recovery process are these are experience of my own. So, if you have any concerns or questions, please reference to your doctor. Thank you. So, just again, 2 months ago, I had a shoulder revision surgery because I had a rotator cuff tear. It was killing me. It was hurting me. Now, the biggest issue was that I already had my shoulder surgery replacement in 2010. I also have it done on my other shoulder as well. So this one is done in 2010, and it was replaced with a standard replacement. There's two type of replacement. There's a standard replacement. There's a reverse replacement. I'll show you what those are. Here's the standard, and here's the reverse. So I had the standard replacement on my shoulder in 2010, and just months ago, the well, actually, it's quite a bit ago. It's more than a couple years ago that I started hurting. It wasn't hurting really bad, but over the couple years with a lot of movement, a lot of things that's been done, the rotator cuff has torn quite badly. That I was actually having severe pain. So this was not a planted surgery. Although, if you have seen my other videos before, uh, 4 or 5 months ago, I had a hip revision surgery. I had both hips replaced as well in 1995, 1996, and that's all due to the damage from ankylosing spondylitis, the autoimmune condition. And yes, the ankylosing spondylitis on my body is quite severe. It has done quite a bit of damages in my body, and the hips was the first one to go. So in 1995, 1996, I had both hips replaced, and usually the hips can only last for a certain amount of year, and you need to replace it again. So I actually used it up, stretched it longer than I needed to. Um, so I had a left hip replaced uh, in April of 2024, and that actually went quite well. And today I am feeling it's already feeling like my own. Right now it's in September, October. So for this many years, many months, um, I'm already feeling like my hips is getting back to normal. So at least I am out there and walking, doing my exercise. At the least, my hips are working, so at least I'm glad that's functional and healing correctly, and the surgery went correctly right. I am able to walk up the stairs, and this is what I do, right now for a daily exercise. Is at least my hip is functional, so I can do my regular walking. So I had one hip replaced, and I had another hip. My right hip was a planted surgery that I also need to get done. But however, my shoulder was not in the plan to get it done. I wasn't expected to have a shoulder revision done because I didn't think I would need it. But it hurted a lot, so I went to my surgeon, got the couple of X-rays, and he told me that there was a rotator cuff torn. I went to two surgeons before I actually make the decision on doing the surgery, because one of them told me that he probably had to. My initial surgeon that done the surgery in 2010, I went to see him. He said you have to go in there and maybe replace it with a reverse implant. And so that kind of got me scared. I went and got a second opinion, and the second opinion doctor, actually surgeon, came out to say exactly the same thing. The rotator cuff tear, since I already had the replacement in here with the standard, um, for them, in order to fix the rotator cuff, basically they have to go in there and do a revision and put in a reverse shoulder surgery in here, reverse implants in here, reverse hardware. So uh, the surgeon I went with is not my initial surgeon. It's another surgeon that was referred to me by my hip surgeon. The hip surgeon has done a great job on replacing my hips, and it's working fine. So he recommended this particular surgeon. This surgeon really mainly does the shoulders and the elbows, so to speak. So I would think that he's more specialized into just focusing on the shoulder. So I went with him. Uh, well, little that I know, in 2010, 2011, where I had these two replaced, I did not remember that I had this bad of a experience dealing with the nerve damage. Although on my left shoulder, when I had it done, my pinky, I lost the sensation, my pinky, but I did not lose my functionality. It took me months before this sensation came back. But this particular revision surgery, it pretty much damaged my whole brachial plexus here, and I just completely lost my functionality. I was able to get a hold of my own neurologist. He actually did a uh, EMG, as well as the NCS, the nerve conduction test on here. Well, the good news is that all the nerves are still intact. It's not cut. It's not broken anywhere. However, at this current point, 2 months from now, there's one, well, at least there's one nerve that's not firing. I believe it's called the ulnar nerve. It's not firing. So um, it's still not functional. I have the no the arm has a lot of weakness. The muscle is not it's not tightening. Oh, let me just show you. Well, I'm still on a sling after 2 months because uh, the last couple of days up here has been hurting a bit. So I'm keeping my arms on a sling a little longer than I usually. I do take it out to get some rest, but I believe because of the nerves are not functioning, my muscles are not tightening. So when I let my hands loose longer than usual, um, it feels like it's pulling my arms down. Makes sense? So the nerves is not working, the muscles are not working at this moment. So right now the only function, I do have some functionalities. I can at least move my arm a little bit upward this way. I can't push it downward. I have no power pushing it downward. It's still swollen. You can see that. Now I can move my fingers inward a little bit, but I can't stretch it outward. I cannot do stretch it outward. So this nerve down here is not functional yet still. So I'm hoping that over times this nerve will come back. So in the last 2 months, basically has nothing but frustration. Because you go into surgery, you expect something to be fixed and to be better, right? But came out to be worse than it is, and this is definitely a severe stretch damage on my brachial plexus. My own neurologist is pretty much shaking his head on what the surgical team has done. I know it's actually a pretty big surgery procedure, because when they open it up, they have to push my arm aside, and they have to remove the actual hardware, the standard hardware, and then they put in the reverse shoulder replacement hardwares in here. So there's a lot of work involved, but they should have still been more careful with it. And for anybody who is going into shoulder surgeries, I would suggest you talk to your team and bring this up to them. Tell them, make sure that they be very careful with the nerves, because over nerves coming back, it takes a very, very long time, and I don't know what the recovery process is, because I have not been through it myself. I love to hear from you guys if anybody has ever gone through any of experience like this, or any kind of a nerve injury. Let me know. Tell me how you dealt with it, and how long did it take for you to recover. What your functionality is. That would probably help me ease my mind a little bit, because sometimes I'm still going crazy. I'm still, getting a little bit worried, a little bit concerned, and pretty much scared that I will lose, the functionality of my arm, and that's not my, ultimate goal. Is the ultimate goal was to get this pain fixed, so I can be, you know, feeling pain free, and move about to do the things that we like to do, right? So yeah, so at this particular moment, 2 months after, I am doing some occupational therapy now, and luckily, the surgeon probably knows that it was a pretty severe damage, and he was willing to see me whenever I needed to go see him. And I did went to see him quite a few times. Did the ultrasound on the neck here, the nerves, to make sure it's not cut. And it shouldn't, because he does this surgery many times. The cut comes in here. The nerve should come through from a little bit further in the back. So it should not be cut, but when he pushed the arm away to do the replacement, it pretty much stretch the nerve a little bit more than it needs to be. So my ultimate goal right now is to basically hoping this nerve will come back pretty soon, and as well as getting this heal. Um, I had the planted surgery that I was going to do just a few months from now. Get my right hip revision done as well, but right now it looks like that has to be pushed back. And when this pain came in, I was expecting to get this done so I can have a fully functional arm that can help me support my hip surgery. Because after the hip surgery, I will pretty much almost have a month of time that where I cannot put full weights on my body. So I rely on a walker or the crutches a lot more. And I did not expect this, damage to happen. And this is unexpected surgery with unexpected results. It sucks, I tell you, it really sucks. So this video is basically, giving an update on what's going on after 2 months, and how the shoulder surgery revision went. This is a very rare occasion that happens, and most of the shoulder surgery will come out just fine. You probably there's a couple of days, you probably lose some functionality, and it's very normal. But going on what I have been through, it's not, but it's a very rare occasion. So if you're ever gonna be thinking about doing a shoulder surgery, don't be too worried and concerned and scared about it. It for me, like I said, it's a very rare occasion, but do make sure you want to bring things up to your doctor, hoping they can be a little more careful, your surgeons, and they can go through the things with you. You can kind of in your mind you wanted to have a few questions for them. So make sure that they understand anything go wrong can cause more frustration than it needs to be. Again, I would love to hear your experience if you had shoulder surgeries before, and if you ever dealt with any of the nerve damages. Please leave me a comment below, and I would love to see how your recovery process is, and I'd love to hear what you had gone through and learn from you as well. Um, if you have any questions that you want to know, yeah, leave me a question. I'll answer as much as I can, and then to the best of my knowledge. Again, thank you for watching, and I'll see you on the next one. Thank you. Bye bye.